I'm Dr. Troy Spurl, and our podcast is Synapse SNPs. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse SNPs each and every week, where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's official Synapse, SYNAPSE.com. Hello, welcome to Synapse SNPs. It's Dr. Troy here, and today I have a very special guest. It's Dr. Ray Strand, one of the people that I highly respect most in this world, and someone that I have learned a lot from myself. And we've our paths have intertwined many times over the years. So I also consider him a friend and a colleague. So with that, I just want to introduce the people. Many of my patients already know who you are, Dr. Strand. But for those that don't, he is an author. He's authored many books. He is a brother in Christ and just a good overall man and a good doctor. And so one of my favorite books, though, you were way ahead of your time when you wrote the book, What Doctors Don't Know About Nutritional Medicine May Be Killing You. So way ahead of your time. So I thank you for joining us, and thank you for coming on.
Well, Dr. Troy, thank you for having me. This is going to be fun, and I'm looking forward to this entire podcast.
Yep. Great. So we're today just going to be discussing a little bit about healthcare, or a lot about healthcare, your experiences and current state of our healthcare system, some solutions, things like that. And we're just going to go about 40 minutes here max. And we spoke earlier that this might end up being more than just a one-time thing, as far as just one conversation, just because, I mean, you and I spoke just last weekend on Saturday, and just touching the surface of some of the things in our conversation, we were about an hour into that. So I'm looking forward to having this discussion. Let's maybe start with just how long have you been in healthcare? You're a medical doctor. Tell us a little bit about your practice, how long you've been in it, and just some of the things that have changed in your years of health.
Well, Troy, I'm an actual traditional physician. That's the way I was trained. I graduated from the University of Colorado Medical School back in 1971, so that dates me pretty well. Started practice in June of 72, so I've been in practice over 50 years. So I'm no spring chicken, but half that time, I was your traditional doctor. I was taught that supplements was nothing but expensive, just created expensive urine, and that it did nothing. And that's what I was taught, and I believed it, and I taught it to my patients, and I was very kind of mean about it. Any of my patients come up that wanted to be on supplements or that, I food-fooded and did pretty much everything I could to get them off. So I guess when I got my degree, why I got into medicine is I wanted to be that true healthcare expert that everybody trusts. And, when you get an MD behind your name, Troy, that's all it takes. Everybody thinks you know everything about everything. And that's kind of, they ask me questions about supplements or exercise or, diet, just everything, and all that. And I was the authority, and I believed that. And, and about halfway through, about 23 years of my medical practice, I had an experience with my wife who suffers from chronic fatigue fibromyalgia. And I'll just share this because everybody wants to know, how in the world did you go from here to where I am today?
Yes.
You can thank my wife. And my wife married me. We'd been married about 20 years, and she had chronic fatigue fibromyalgia when I married her. And she thought when she married a physician that her health would get better. And nothing could be further from the truth. Every year she got worse and worse and worse. And in 1996, she came down with serious pneumonia. And we got her through the pneumonia. However, she was left with a very fatigued state, couldn't get out of bed more than an hour a day. This was in spite of seeing 4 different medical specialists who put her on 9 prescription medications, none of which did any good. And this went on month after month after month. And there's nothing tougher, and you know this, Troy, there's nothing tougher than not being able to help your spouse in their own health.
Yeah.
I mean, my children, one had to stay home every day to take care of her from school. So I could go to practice and all that. Well, I asked my cohorts and specialists that I'd gone to, well, how long is this going to last? And they couldn't give me any confidence. Said, well, we don't know if it'll last months, years, or ever get over it. Well, it was about that time that a neighbor actually brought in some nutritional supplements to my wife. And of course, she knew how I felt about them. So I remember coming home that night and she told me, gee, this lady brought off some supplements and helped her husband, wanted to know if I could take them. And I was even surprised with my answer. I said, my goodness, we're not doing anything for you. You can try anything you want. And to my amazement, and I don't share this too much, but the truth was within 3 days, she was better.
Yeah.
3 weeks to a month, she was off all 9 medication. And Troy, I didn't know if this is a miracle of the Lord or my worst fear, that she actually got better taking supplements.
Right. I get that.
And so here I was, it was really, I had to face the truth. And in reality at that point, I had become a believer by that point. And I actually said, what's going on? And I just couldn't ignore seeing my wife's improvement. And she continued to improve, month after month after month. And she got back to normal activity. So I started researching the medical literature, because in medical school, all we learn about is drugs and disease. When they say physicians are disease-oriented and they're drug-oriented, that's where they are. That's their training. They don't know anything. And Troy, big pharma controls everything. I shared that with you last. I look back now, and what I find is there wasn't a meeting I went to, a continuing medical education meeting or anything in medical school or anywhere, where the meeting was not sponsored and paid for by big pharma. I can't remember what.
Yeah.
And they controlled everything. And so as I look back, as I research and learn more about, nutritional medicine and preventive medicine, I started to realize, I wasn't that healthcare expert I wanted to be. I was really a disease care expert. I knew how to diagnose disease, treat disease, where to go. I was actually pretty good at it. I knew which drugs to prescribe, what procedures to prescribe. And that's where we were. And I think physicians, just to give them, if I'm going to give them an out, they're putting out fires all the time. That's what, if you're in medicine, you're putting out fires. I wanted to share this if I can. I can never go to the hospital, and I'm a family physician, and I did obstetrics for 21 years. I did, we always scrubbed in with surgery. I did a lot of hospital work. I always believed in that. And I remember going to the hospital, you had to print out your patient's list when you went in. Well, I'd watch the cardiologist walk in, and that list kept coming and coming and coming. I mean, you could use it for toilet paper. I mean, it was just, so they're running around seeing all those people that had a heart attack or, in the intensive care unit. And as they're doing that, they got to call, someone's in a cardiac arrest down in ER. They're running down there, taking them to the cath lab. And then when they get done with that, they try to finish the rounds, and then they go and they go to their office and see all those people who a week or two previous had their heart attack and all this. And then they run back to make the rounds at the end. And that's their life. How much time can they spend to talk to someone about preventive medicine or lifestyles or something like that? And so that's where I started. That's what I look at medicine. And big pharma controls it. They control medical knowledge. They control everything. You and I talked about it. The thing that really bugs me is back in the late 70s, we had a lot of good medications that we were using, and various things have been out for years. Well, the FDA decided that you could not have a drug on the market unless they were not only found to be safe, but effective. Okay, here walks in the double-blind, placebo-controlled clinical trials, and if you don't have that, then you don't have anything. Then you can't make a claim. You can't do this. Well, what they did is they cornered the market, Troy.
Yeah.
It's all, it cost around $700 to $800 million to take a molecule from the lab and get it in as a drug on the drugstore shelf. Who has that kind of money? No one. Functional medicine, nutritional medicine, they don't have that. And
No.
so what they did by doing that one thing, they eliminated competition and controlled the narrative. And that's the world we live in right now, Troy. And that's the change that is coming. But that's kind of my story in a nutshell. We'll talk more about where I went after that.
Yeah. I mean, that's a good place to start, because one of the things that you really touched on there was the double-blind placebo studies, and it's the excuse that is given a lot of times as to why something doesn't even get looked at. And so, and you gave me, so for people who don't know, I will call Dr. Strand, and I called him to ask for some guidance, because I'm entering into a phase of my life where I believe one of my dreams of a new healthcare system model is coming to reality. And so I do want to touch base on what you think, if you think our current health system is collapsing. But you said something very, very key in our conversation, where you said, don't fall for the game of the double-blind placebo trap. Don't fall for that trap. And I didn't know what you meant, but you just described it beautifully, because it is how they cornered the market. And functional medicine doesn't work that way, because there sometimes are many, many variables as to why people get better. And we should be studying and researching why, when people do things in conjunction, why they get better. And yes, sometimes it's one small thing, but the entirety of the scenario is they want to find the one thing that makes the change, so that they can profit off of that one thing.
Mm-hmm.
When in reality, it might be diet, lifestyle, exercise, and a supplement, or something completely different. But that's not necessarily how your mind worked, especially towards the end of your career. So do you care to share any more information or a story on just, I think you mentioned one about Colorado as far as a study you were in or a part of, if you want to touch base on that.
Well, I got really interested, not only in nutritional medicine, but there's a guy named Dr. Gerald Ravens, who's a researcher out of Stanford, who had identified what he called Syndrome X in the 80s. It eventually became called the metabolic syndrome, and then prediabetes, but it's all the same thing. It's just insulin resistance syndrome. And what he found was that as we live our life, and usually it's poor lifestyles that get us in the problem, and which is all the all-American diet and inactivity, we become less and less sensitive to our own insulin. And what the body does is, over maybe 5-10 years, we eventually tip over into this abnormal metabolic state. And it's insulin resistance, and you're just not as sensitive to the insulin like you once were. Well, how does the body compensate for that? By making more and more insulin. But as blood insulin levels rise, to try to compensate for this insulin resistance, there's a constellation of problems that occur. You get central weight gain because you can't utilize calories normally. Blood pressure goes up. It's called dyslipidemia. Your triglycerides, that other fat in the blood, goes up, and HDL goes down. And then eventually your blood sugars start coming up. That it's also known that it's the main reason we get obstructive sleep apnea, polycystic ovarian disease. It's all expanded. So in the 90s, and I think this was a Lord in my life, I think the whole thing is just his hand's been on my life since I've been there and revealed. But back then I said, jeepers, if it's poor lifestyles that creates the insulin resistance, maybe healthy lifestyles that actually improve insulin sensitivity is the answer. Excuse me, I'll just,
yeah, that's revolutionary right there. That's revolutionary thinking in healthcare.
Yeah, but anyway, so I started to research the medical literature in regards to everything that would improve. And it was a triad of healthy lifestyles. It was diet, learning to eat in such ways you don't spike your blood sugar, eating the whole foods, whole grains, nuts, and then modest exercise. You didn't have to be a superstar, simply walking briskly 30 minutes, 5 days a week.
Yep.
and then nutritional supplementation, not at the 1 a day range, but optimal levels, which may get into in future. Anyway, that triad. So I started doing it in my medical practice, and behavior modification is very, very tough. We work through that. We learned that people needed to write down everything and all this. Well, I started to have tremendous success. So I actually did 3 clinical trials, and this is what you're leading up to, that all were done under an IRB, the FDA guidelines. And eventually we actually had one done at the University of Colorado Medical School, and using my program that I was doing in the office, only put it online. Well, we sat down with the endocrinologist, Dr. Holly Wyatt, at that time, and she basically looked at us and said, my goodness, we won't know what's working. We don't know if diet's going to work or exercise or supplements. I mean, what kind of clinical trial is this?
You're right.
See, they want one molecule, one thing that they can look at. And that's why all the studies, they'll study vitamin E, and then they'll study vitamin C, and then they'll do magnesium, they'll do selenium, because they look at them as drugs. But these aren't drugs. These are just nutrients we get from our food. But because we can supplement now, you can get them at levels you can't obtain from your food. And there's health benefits in all these studies, even when they do a single drug or a single nutrient. So she was just, well, I'll do the study, we'll do it. And she went through it, and she, oh my goodness, you got great results here. And we were reversing this pre-diabetes and my clinical practice. I mean, if my people carried out 18 to 24 months, I had many diabetics reverse their diabetes. I mean, I documented it. Yes. I repeated their hemoglobin A1Cs went down, their 2-hour, we did a glucose a glucose tolerance test. We did all that stuff, and they were normal. And they stayed normal as long as they stayed with their program. So I knew with this clinical trial that 90% of type 2 diabetes now could be prevented, and some of it can be reversed just by lifestyles. Very, very awakening for someone like me who had been using drugs all my life. And I'll lead into another story, but basically the reason I want to bring that up is they panicked because they didn't know what worked. And yet the group that was doing this, and that, and it was USANA was involved with that and everything. And that's where we met. And shoot, they could care less. We just want to see improvement. We want results.
we just want people to get better, and this is showing that they're getting better. We can figure out the why exactly afterwards, but the first level of just looking at these studies, there's nothing wrong with just having great outcomes. And then you can start to look at, okay, if we take out one of the variables or just start with one variable, do we get the same outcomes? It's fine to do that type of science later on, but they're not interested in the group effect. And there's another researcher by the name of Dr. Dale Bredesen who wrote the book The End of Alzheimer's, and he said the exact same thing. When he had his aha and his breakthrough, he realized there were multiple factors involved with what was creating the physiological imbalance that led to the memory loss of Alzheimer's. And he realized he'd been a researcher for over 20 years in the Alzheimer's field, and he realized how they're doing the research is wrong. It's backwards. It's not going to fix the actual problem of Alzheimer's disease. So all of these hundreds of millions of dollars that are poured into research for medications or for whatever, and he was told personally to stand down and that he wasn't going to get funding for his research because they wanted one drug to fix the entirety of it, and then that's what hit him. It says it's not going to work.
See, and Troy, here's the thing: it slips in now to functional medicine. Okay, observation. You're observing your patient and how they respond. And see, I would do this triad of healthy lifestyles, and I got people have tremendous results. So, I followed them up. Saw them in 6 months or 9 months or 12. They came back, and some were doing great. Some, they weren't doing as well. And I looked at them. What did you give up? Did you give up exercise? Did you give up diet? Or did you give up the supplements? And invariably, they had given up one or two of those. And my experience was the same. If they didn't get results, if I got my patient to make one of these lifestyle changes, I saw some improvement. If I had them get 2 of the 3, and it didn't matter which one, 2 of the 3, I saw a little bit more improvement. If they did all 3, the results were simply fantastic. So I knew this was not an easy thing to reverse and that, but how did I come to that conclusion? Observation, just
Yeah.
clinical judgment, seeing that, and that's what's left medicine. We are we're cookbook physicians. Everybody does protocols, and nothing has concerned me more, and lost faith in the medical community than the pandemic, the COVID-19 pandemic. I mean, everything was cookbook, and you had to do this protocol. And if you didn't do this protocol, then you were not only not a good physician, you should lose your license. You should lose your
Yeah.
practice. You should go to jail.
Yeah.
And I'm sitting there going, this is really, I mean, you really start to think, my goodness, where have we gone wrong? What happened? My patients, I've been out of clinical practice for about 15 years at that point. My patients were calling me up and they say, gee, Dr. Strand, I just went, I got tested positive for COVID. I'm sicker than a dog, but they didn't give me anything. They didn't give me any guideline other than, my lips turn blue and I can't breathe. Go to the ER.
Right.
Well, then
Yes.
you go in, and then you got a protocol. So number one, not early treatment, nothing. The patients weren't even given a trial of anything.
Yeah.
And then they turned around and they go into the, hospital, and here they get remdesivir, they get vancomycin, and kidney, and then all of a sudden they get through the inflammatory. Wasn't. We all know that, but they ended up on a ventilator, and studies show only 1 in 30 came off the ventilator.
Yeah.
Now, wouldn't you, as a physician, if you're sitting there and you're seeing your patients, now, why would you recommend a ventilator? See,
Right.
that's what's missing. And we couldn't talk about it. We couldn't discuss it. And so here we go. And you look at this, and this is where I think we need to go in functional, nutritional and functional medicine, is common sense and knowledge. And you're a gifted healer, Dr. Troy. I've seen it. I've been involved with you. You're my personal physician, and I appreciate every time. And the results I get. But you're always thinking, and it's this and it's that. I can't put that together. I'm too drug oriented. I believe in healthy lifestyles. I work and I get great results. But I think that's where medicine we got to go from cookbook, big pharma control. And I guess, these are just where I've learned. So, I'm rambling here, but that's really my concern.
No, it's brilliant because for us in functional medicine, one of the ways we say it's probabilities of sum of potential. As you make a change in one body part, it's going to have an output that affects other body parts. So healthcare is more of a dance or an orchestra is a better way of saying it, where you have 100-piece orchestra and all these moving parts. And so it can become very complex, but you can actually start to see it when you start looking at it, and you start to see the beautiful music, and we're wonderfully and beautifully made. And you can see how when it works together, how everything just works. When there's a breakdown in communication or timing or whatever it is, we see dysfunction. So measuring dysfunction early on can help prevent disease and more serious stuff. And I think there's a beautiful blend coming of functional medicine and traditional, because there's still some good stuff with traditional medicine. There's a lot of good stuff. I personally believe that our emergency room department and urgent care is the best in the world. And we don't really want to mess with that because they save so many lives when it comes to that. But there's one thing I'm going to get you to talk about this, because how you describe this is what I really want my listeners to understand, my patients and the people that listen to us. You described basically the track that the traditional medicine took and has taken. It worked 100 years ago, but talk a little bit about how they're using that same philosophy to try and treat chronic disease, and how that kind of plays out, and why that's a challenge, and really how it's not working.
Well, I can share that. It's very interesting. It's kind of something I've learned over all these years. And the more you study, you go back and look at, the Second World War, a little bit before, sulfa comes in, penicillin comes in, different antibiotics, and we were seeing people come in and boom, they got better quickly. And all of a sudden, I call it attack medicine. They're going to attack disease, and they do this, and they had great success for a couple decades. We got stronger, more powerful antibiotics. Even though there was antibiotic resistance, it worked. Well, then what happened is I saw medicine try to attack chronic degenerative diseases like they did acute illnesses. And, at the turn of the century, 1900, all of that, I think 80% were dying of infectious diseases. They had great success, and all of a sudden now 80% are dying from chronic degenerative disease. So what are we going to do? We're going to attack this, and that's where the drugs come in. Of course, Big Pharma loved it. I mean, they're going to take drugs the rest of their life. We're going to take statin drugs. We're going to treat your blood pressure. We're going to treat this or that, and that's the mentality. The problem is chronic degenerative diseases aren't like acute infections or things like that, or TB, or, just different things that they were dealing with. And so what I found as I looked through this is that, we are so in love with our drugs, but I'm going to put a corollary here with your functional medicine you may have never thought about, or you have, and to express it. But when you're talking about that, when you get a drug, they're looking for something that's going to change a certain chemical reaction within the body, a natural chemical response. They're going to block something. Let's go, let's go to Pepsid or Prilosec or something. They're going to block this so you don't make as much acid and you get better. And some of those, Tagamet was the first one to come out. Hey, they're all thrilled. We had great results. But that's the good reaction.
Yes.
But in the body, it affects other things, and it has negative reactions. So every drug, because it's synthetic, okay, not natural to the body, it has adverse reactions. And so we don't know them, and that's why when I wrote my book, Death by Prescription, it was really an eye-opener for me, because I had just coming out of this, and I realized that, Big Pharma and the FDA, once they approve a drug to be released to the public, they knew less than half of the adverse drug reactions.
Yeah.
Well, then the question, well, how did they learn the other half? It's you. And I had a chapter in my book called The Great Clinical Trial, You.
Yeah.
And the other reason that's important is over about a third, 30% of the deaths in the United States and Canada were due to adverse drug reactions. Well, jeepers, you don't see that on a death certificate, just like you don't find it isn't
Yeah.
there. But yet the studies, JAMA, New England Journal of Medicine, British Lancet, they all kind of come together that over 30% of deaths are due to adverse drug reactions. 100,000 are due to properly prescribed proper medication. Another 80,000 are due to improperly used medication. Now, you think about that. Oh, we're doing this and we're taking a drug, but I didn't write the book as don't take drugs, but I said, you can't trust your doctor, your pharmacist, the FDA, the CDC, you can't trust anybody. You trust yourself. And how many times I've told patients that you read on it, you check it, because why?
Yeah.
They know their body. And they would come into me and they say, Dr. Strand, that blood pressure pill you took me on, do you think it's causing such and such? No, I don't think that's not good. Then they'd pull out this little piece of paper and show it to me and go, well, let me check that out.
Yeah.
No one reads that whole thing. I said, I think you better get off that, that blood pressure medicine is causing your cough. And so, but it's the same thing what you're doing. But see, what are you dealing with? You're dealing with God's natural creation, the natural immune system, the natural antioxidant defense system, and its natural repair system. You're optimizing that. What are doctors doing? We're prescribing a drug. We're going to give it to you. Yeah, it has some beneficial effects. So we've shown it. That's what they go through. But it's got a lot of adverse reactions too. And that's the game that's being played. So what I have found, and this is where I think the blend is, and I'm really kind of, there's a concept in medicine called first step therapy.
Yep.
And that concept is that when I get a patient into my office with early diabetes, pre-diabetes, maybe they got early high blood pressure, elevated cholesterol, the heart disease, that the medical community is encouraging me to offer them a trial of healthy lifestyles as my first step to therapy before I prescribe a medication.
Yeah.
what happens, Troy, is when I talk to my doctor friends about this, oh, yeah, the reaction is, my patients are never going to make those lifestyle changes. And even if they do, they will not be clinically effective. So I'm going to just write my prescription right now. But here's what happens in functional medicine. If you give those people a trial, they all improve. And I'm trying to get physicians as we come into this to use medication as a last resort, not a
Right.
first choice. That's very key, because most of my patients can avoid medications altogether and have these wonderful clinical responses to what we know works at the same time. And if they don't, then my medication is going to be more effective. I don't have to stair step and get them on 3 blood pressure medications. They respond to the first one.
Right.
So I think there's a marriage here that's going to come. But first step therapy is something that's got to be pushed and pushed and pushed and offered. Now, you get a patient comes in, and I'd say 80% of my patients would say, "Oh, doctor, I'd do anything to stay away from those drugs." And then 20% said, "I'm not going to do that. Just write this."
Yes.
Well, you've just done, you figured it out right there what you got to do.
Yeah, and we've made essentially a career out of doing the first line therapy, and we're of like mind there. And so I know this is how I know that there's a need for it and that it's successful. We started in the insurance world. I soon realized that my first year that I wasn't going to be able to practice the way I wanted to practice. So I opted out. We became a cash clinic where people had to pay out of pocket, which is unfortunate for them, but it gave me control over what to recommend for my patients. And we started doing full lifestyle therapy programs. And we only keep our doors open if we get results. When you're a cash clinic, you have to get results, or you close the door. And so we went from a small 400 square foot room to a 6,000 square foot facility, treating people because of demand. So we know that there's a demand there for it. You mentioned just a couple things about just how the doctors and were looking at stuff in first line therapy or not looking at things. One of the things early on during COVID, you and I spoke to each other, and I could tell by the conversation, you remember what it's like. We're like feeling each other out, like, are you landing on this conversation? What are you seeing? And I remember when we both came to the conclusion that you're seeing the science the same way I was seeing the science, and we were both of like mind about just some of the stuff that we're seeing happening with COVID and the bad treatments that are being recommended or non-treatments, and then the successful outcomes that were there. And the people, number one, you read research and you actually looked into it, which I'm going to say the majority of doctors didn't, or even healthcare professionals or people didn't. One of the things that I really disliked more than anything was when I heard the phrase "trust the science," and then I had to have frustrating conversations of, number one, there's bad science. You have to learn to discern through the good and the bad, who funded what article, number one. But number two, you're saying that because you're trusting a scientist, Dr. Fauci, on CNN or Fox News or whatever it was. You're not trusting the science. It was early on. I did a little show on Dr. Fauci when I think he was talking about masks and some other stuff. And then there was a new research article that came out with the vaccines that was talking about how the vaccines worked and how they were safe and effective using those words. But when I read the research, day one, I have a Dr. Josh here as part of our Synapse podcast. I went through it with him, and I looked at that research, and I said, they're making a lot of assumptions here. The biggest of which was when you inject the actual vaccine into the site, it downregulates the toll-like receptors, which for the people listening, that helps protect our DNA. It's our immune system inside the cell that protects our DNA. But you have to downregulate that to allow the vesicle that delivers the mRNA into the site. Well, they're assuming that it's going to turn back on. If it doesn't, then you end up with cancers. They also made an assumption that the presenting antigens would actually present it and not have any escape of the spike protein into the vascular system, which we now know is not true. That didn't happen at all. So when it comes to trust the science, tell me just a little bit about just your take as you went through COVID, because COVID was kind of like the amplifier of what you're talking about. And it became so obvious to people who are willing to look at research. So maybe just talk a little bit about just your experience as far as what COVID did as far as your impact on our current healthcare
Well,
system, and then we'll go from there.
what I found was that it was a very, very discouraging time in my life. Here I wanted to be a physician. I worked with these people, and I just saw my whole profession fail me and everybody right in the midst. Who should have been the strong people standing up would have been the physicians. Were individual nutsos. I mean, we got egos more than anybody. How in the world did we kowtow and follow and drink the Kool-Aid? All this. Every time we learn through different things change in medicine. We all know that.
Yeah.
We look at, I'm not going to get it. We don't have enough time. But the point was, so it was you follow this protocol and this thing, and then you're practicing good medicine, and the protocol you just assume was based on good science. But now we are in the middle of the Great Awakening. And I know people have heard that, but in medicine, it's there.
Yeah.
Fauci lied to us. The FDA lied to us. The CDC lied to us. The NIH, they printed false studies in the British Lancet that ran down ivermectin and hydroxychloroquine, which were helping, that were safe medicines we'd been using for 5-6 decades. They were safe and they were effective. And I was in my own little practice. These people were calling me. I could start them, and man, we got them through. They didn't end up in the hospital, and pretty soon I ended up, my goal was to keep them out of the hospital, which I call the killing fields. How in the world did we do that? How can a nurse sit there and see their patient in there suffering, and they don't go in to clean them, they don't go in to change their gowns, they don't go in to take care of them, and they ignore them? Because I talked to patients that were there, and this is well documented. And I mean, I'm sitting here, so I've lost tremendous faith. I'll give you a good example. The FDA, we had this emergency use authorization of a vaccine we didn't know, which wasn't a vaccine, it's genetic therapy. So it was mislabeled to begin with. But in their application for the emergency use authorization, Pfizer and Moderna stated that we do not prevent the infection, we do not prevent transmission. In that, and yet we couldn't find out about it, we couldn't do this. And there's a thing called informed consent. We're supposed to inform our patients, this is the problem, these are the risks, these are the benefits, you make the decision. When do we do it? We gave it up, it's law. We then turned around and we made all these claims that the vaccine was safe, it's effective, it does this, and now we realize what you got into, that I mean, it's damaging our immune system. It's doing just the opposite, and you can't get it out. I mean, we're finding some natural stuff. We're now trying to neutralize and get rid of that dumb spike protein. But what sense does it make? I'm going to give you a vaccine, so-called, that lets your body make that toxic spike protein that's causing all the problem again, but we'll make your body a factory to produce all that.
Yeah.
Now, that's follow the science. Are you kidding me?
I know.
That's a bunch of garbage. And then what happens is, not only it didn't work, didn't prevent everybody that got the vaccine. Well, I got sick. They go, but I would have gotten sicker. I would have that line, and it goes on and on. So what happens is that this is going to create a wait, because people now distrust the FDA. They distrust, government. They distrust the CDC. And we had to figure it out, Troy. You and I, we had to go to the VAERS, and we had to go to open VAERS, anywhere where it gets some information, because they weren't sharing it. And why weren't they sharing? You couldn't do an autopsy in our hospital that if you died of COVID. You couldn't do one.
Yeah.
Well, what's that all about? I mean, these are young people coming in. We want to know, but we don't want to find out. We don't want to know. We don't want to. So that's my concern, and I know that's a little bit of a rant, but it is where it's going to usher in exactly what you're doing, because people now are aware. Because in the end, I told you, It's the consumer who makes the decision. You know,
Yep.
it's not going to be the FDA anymore. The big pharma, they've shot themselves well in their foot. And people are going to start trusting their health. And that's what it's all about. It's about health. It's not about disease. And, you know, we got the disease care expert. You want to do that? Go to your MDs. They'll do a fine job. That's what they do. But if you're concerned about protecting your health, and I always like what the gentleman always said, you know, we're living too short and dying too long.
Yep.
And we're suffering from these chronic degenerative diseases because the drugs, they don't help. Their attack philosophy has not worked. And yet you're taking people that have been through Mayo, and they go here and they go there, and they're getting the best, and yet they're suffering. And when Mayo can't help them, the drugs don't work, you know, it's out the door. And that's who comes into your office. But they're going to start coming in earlier. And that's where functional medicine is going to take the role and treat people the way they should be treated.
No, I agree with you with that, as far as just getting people in earlier too, because early on with COVID, we found out that early treatment was key, number one. Number two, we found out that our patients who had normal zinc and vitamin D levels, which are two key components of our immune system to fight intracellular and extracellular infection, did better. People with good sleep habits who didn't have sleep disorders also had normal melatonin levels. That really did help with the breaching of the non-breaching of the lung and sinus mucosal barrier systems. So the people who had foundational healthy areas of their body working did very, very well with it. And then a little bit later on, we did find that nebulizing with iodine blocked 94% of the transmission in the nasal cavity. So that was another big aha. That happened by sharing information, and we had to do it like secretly. I remember having conversations with you saying, what are you having success with? And I had this. I followed people like Dr. McCullough, who was very vocal, and other. I was fortunate enough to have lunch with him early on the day before he testified before Congress and pick his brain with everything he was seeing. And we were seeing the same stuff. And so a lot of this information we had to pass to other doctors around the country and around the world, really. And it was the first time I had ever seen doctors speak up, just questioning things get shut down, canceled. And our stance was the truth will always hold up to scrutiny. So let's scrutinize.
You know, Troy, I'm going to just throw in, here's a perfect example. You mentioned vitamin D. There were 5 studies I researched, talk about studying the science. If you were at the certain level of vitamin D you and I recommend, it prevented 70% of the COVID infection, 70%. And yet that was going around, everybody was agreement, except then all of a sudden doctors out of California were recommending vitamin D3. They not only were banned, they lost their license, and some were even threatened to go to prison. Now you tell me, is that normal? That people should sit back and say, there's something wrong here. There's something wrong with this picture, because vitamin D is not going to hurt anybody. It's there. It's wonderful. The zinc, you know, we talked about, and we both had success with these, you know, repurposed medications, drugs that were there. So medication was important, but it was proven medicine. It was there. So yeah, we had to kind of rely on each other, Troy, and because it was the secret society, because everybody was getting nailed.
Yes. Well, and really all COVID was like a magnifier of what had been happening subtly in the previous decade. So God really did like allow it to expand and become more obvious. So we know that that's part of the problem, and has been part of the problem. For you, though, and well, for me, and I know we're on the same page with this, but I believe it's going to lead to a collapse of our current model as we know it. Not entirely where it all goes away, but it's going to be cleaned up. And there were medical doctors I know that got their license suspended for recommending steroids during COVID, which ended up being very effective. So we know that there's going to be a cleansing. And what I'm going to say is I am actively speaking out to help people not forget. Number one, we cannot forget what just happened, because we need to learn from it and helping to develop solutions. So it's not just pointing fingers at this was bad, this is bad, this is bad. That's part of it, because some people need to be held accountable for sure. And so I'm definitely going to be a part of that as much as I can be. But what do you see as far as a solution, because there's a lot of challenges when it comes to people accepting a new healthcare model, as far as the establishment, if you will, and what's happening within the American Medical Association and the government. So what, from your point of view, do you think needs to happen to have a new healthcare system? And do you even think we're going to end up with a new healthcare system?
Well, let me tell you, the biggest problem are insurance companies. Okay, that may shock some people right off the bat, but that's the game that's been played. You said, hey, I got to go to cash. Insurance companies won't pay me for what I did.
Yeah.
Well, there's a reason, is because you had to fit in and the AMA is with them. The Pediatric Academy is right there. Everybody's there in the thing because it's the game that's been played for 70, 80 years. And so the insurance companies only pay if you go here and you do this, which is probably much more effective. Well, you got to pay out of your pocket. So we're double paying. And so there has to be a correction as far as that is concerned, that some insurance companies or people can insure and have a wellness program. Do you notice that we pay more because we get in groups, and the people who don't take care of themselves don't do that? Our rates go up, all this. That's the game. The other thing that's going to happen is it's awareness. Drugs, you don't trust them. I mean, my book was such an eye opener for me originally. And I mean, I looked at these drugs that were put on the market that were killed 500,000 people, and before they were taken off. And then they came up with the evidence. They thought one was Resulin as a diabetes drug. I'm just going to use a good example. And everybody thought, oh, this is the first diabetes drug in 30 years. Well, then all of a sudden we found out they were dying of liver failure.
Yeah.
And well, that wasn't our drug. That just incidental. Well, then there was more it's 1 in 10,000. And then there was more and more. And pretty soon they said it was 1 in 80 that took this drug that died or had to have a liver transplant, which you can't get. So you look at that. It's not just the COVID. It's not that. It's been going on for years. It's the game they played. And then Big Pharma, it goes back to the same group of people that approved the drug to begin with. So these 12 people on this Resulin panel, they heard all this information, and 11 of the 12 wanted to keep it on the market. Now, they had to have big Swiss bank accounts or something, because not logical. And I think people have to realize their trust themselves, trust the Lord, trust what's going on. And so the change is going to come from the consumer. The more facilities that are available like yours, Troy, they're gonna get it. It's just a matter of time. It won't happen overnight. A Big Pharma is rich. They're spending billions and billions of dollars advertising everything. They've got people, and so it'll be a journey. But I think as long as we stay faithful to the truth, do the best we can, and try to help our patients.
Yes.
And not sell them drugs. I think, use drugs when they're indicated, and we know that they may be helpful. But I think that's where it is. It's a journey, and you're starting it. I'm proud of you. I think it's something needed. I know what you do is effective, and the more people know and they come in and we get like-minded, it's just going to grow.
I appreciate it. Yeah, patience over profits for sure would be a new concept when it comes to our healthcare system. So I'm on board with that. For me personally, God put that on my heart many years ago, and I do not know why, but I wrote it on my wall. Let's become a worldwide agent of change in the fields of healthcare and human potential. And I, as a chiropractor, that's just insane to think that was what landed. But I really did feel like there was an opportunity for a new healthcare system, that I was going to see it in my lifetime. And I cannot tell you how much COVID, as bad as it was, and how obviously chaotic it was, how much it actually expedited and sped up that entire process. Because now we have hundreds and actually thousands of healthcare practitioners, probably tens of thousands, if not more, who are on board. And they do want something different. And I want to say just one last note to a lot of my friends and family who are healthcare providers, because I had this conversation a lot too, because many of them said, you don't understand how awful COVID was, because we saw the people dying right in front of us. And my answer to them was, you don't understand how easy it was to treat, when you did the right things to keep them out of the hospital. And I understand that there was a lot of failure, but we now know that remdesivir is really hard on the kidney. So when the CNN report came out saying COVID causes massive organ bleeding and failure, no, that was not COVID. That was the treatment for COVID in many of the cases. And so again, a lot of these things could have been prevented with early treatment, and a lot of people did need treatment. So it was a mismanaged part of it. So I want my colleagues who are in the traditional system, who did work their tail off following orders that they were given, to know that I get you, I understand it, but sit down and listen to what we have to say, and you would have been surprised. And my wife, who's just a bulldog when it comes to the truth, worked in the hospital. She's the one that would put people on the vents, and she got in the face of her hospital people because it was the wrong thing to do, and she was being told to stand down, and they were changing universal precautions. Why change universal precautions in the hospital system? Therefore, universally anything that happens. And so they were changing, and what it was really doing was just causing confusion. And my wife, being a staunch Christian, knows where confusion comes from. And so she spoke up and spoke out, and they still wanted her to stay, but she was not playing their game. And so she came to the clinic here, and we started treating people the right way. And I think we spoke about this, but we had many doctors in town who were sending their COVID patients to our facility because they didn't want them treated using the hospital's protocol. And I would encourage my medical people out there who may receive this from a friend or a colleague, if you still think that we're a little bit crazy about our thought process with this, just keep listening, sit down, because we know, we've gone through the science, and we know at this point we're going to be talking a lot about that particular scenario, and the truth will hold up to scrutiny. So scrutinize it. And I got in a lot of conversations, and it was one mini debate with a medical doctor from the Mayo Clinic when I realized that he had not read anything and didn't have any value behind his statements. He was just saying talking points, and he sent me a staff meeting that they had where the boss was talking, and they were CNN talking points. They had nothing to do with science. So to my medical practitioners out there, I want you to hear that I respect many of you who follow the rules, but we're going to need a little class on discernment of scientific information when it comes to just participating in things like this, because I don't want to go through what we had to go through with COVID ever again on any side of it.
Well, I agree with what you're saying there, Troy, and I think that people need to understand that COVID was not as bad as we thought, and early on, none of us knew, and so we all were concerned to begin with. And then the more we learned, the more we studied, the more we realized that 97.9% or 99.7% are going to survive, no matter what your age. It turned out to be more like a cold, which coronavirus is, a cold virus. It wasn't MERS, or it wasn't SARS as bad as SARS-1. But we learned that, and we figured it out, and we all were caught up in this. And it's not like that's why we talked early on. And I just encourage physicians, use your own judgment.
Yeah.
Do your own research. Just don't listen to the narrative. Don't listen, it's there. But I'll tell you, we're going to find out they lied to us.
Yeah.
And that upsets me, because I trust them. I mean, I gave my whole life to it.
Yeah.
And I'm not there. And a lot of people have come out, they've seen it. And that's the awakening. And I hope that that's what leads into a better, more gentle, more caring healthcare system.
I'm with you on that. I want to thank you for joining us here. I know we'll be talking again. We're going to have you back, because I already know my patients and listeners are just going to love what you have to say. And you've been one of the people I lean on for wisdom and stuff for many decades now. So a couple decades. So I appreciate you, and thanks for joining us. And we'll be talking again.
Thank you, Troy.
Thank you for listening to the Synapse SNP podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse SNP's podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or a substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.